My name is Medhat Higazi. I'm 74 years, and I have my daughter legally blind and mentally deterioration. She's in bed 24 hours, and it's a very sad situation. And I've been taking care of her. I'm her guardian, me and my wife. And let me tell you the truth. I am very frustrated from mental health hospital. Repeated what is being said. We've been denied, we've been cut several times, we appeal, and nobody understands the effort to go through appeal process and the frustration and the judgment of the appeal. One time appeal were reversed, and they cut the allowance 50% without any reason. You go to appeal, they reverse the decision. And that happened to me on 2/12. In June 16, they cut 50%, 30 hours, they cut it to 15 hours, fine. We went to the appeal, nothing. I raised 10 questions. Why? The grounds of that. The situation did not change. The condition of my daughter did not change. In fact, it is deteriorating continuously. Nobody listened, and the decision came out. And it is sad, when you don't get the service, you don't know where to go. And you swallow your pride and you put your head down on the floor and you cry. You cry because the system's supposed to help you, not to defeat you. The obstruction, and I give you a simple example. They cut the hours from 30 hours to 15. 14 of them for physical therapists, which given by professionals from Beaumont Hospital. And they train me and train my wife to do that. The exercise has to be done 2 hours a day, 3 times a day. Then they come, they said, no, you and your wife cannot conduct that. Who I can hire to come 3 times to my house to do physical therapy for my daughter for 40 minutes, 3 times. 3 times, driving, coming, and in. And at the end, he gets each time $6. How we can resolve this one? And ended that we don't file anymore. We don't apply for anymore. We're just doing it without any pay or any respect. You know, it's very frustration. And I tried to attend the board. I said the board is open air. It's not open air. I could not get there, okay? And I tried to reach many people, and you get you to the ombudsman to answer, and you get no answer. Then they come back and said, no, your wife cannot do the CLS time. Fine, thank you. And no agency will send somebody 3 times a day for 40 minutes for $6 each time. That's where. Now you tell me you're going to go privatization. As a consumer, I'm getting nothing. It doesn't make difference if it's private or public. Because if public does not help me, maybe private may have the flexibility and the common sense to make judgment on that. That's my story. Thank you for allowing me to speak.
Hello, my name is Nancy Mendenhall. In approximately 2014, all of the CMHSPs and PIHPs across Michigan received the sizable state general fund reduction. On behalf of the 35-plus daily attending members, who attend Crossroads Clubhouse in Warren, Michigan, we are concerned and want to impress upon you today that this funding cut has had serious and long-lasting effects on the well-being of many people with mental illness who are striving to recover and desire to fully participate in our communities. Since 2014, as a result of this significant cut, funds for services to persons without Medicaid, Healthy Michigan, are now very limited. Since this cut, Crossroads Clubhouse was directed to eliminate or reduce 50% of our daily attending Clubhouse members who do not qualify for Healthy Michigan, Medicaid, or are classified as Medicaid spend down with no means to pay the spend down requirement. Crossroads Clubhouse embraces a clubhouse model of psychosocial rehabilitation, offering a comprehensive and dynamic program of support and opportunities for people with severe and persistent mental illnesses. Crossroads Clubhouse, along with all clubhouses, is an evidence-based practice, has proven to decrease hospitalizations, to shorten the length of stay of hospitalizations, to decrease arrest, to help members find meaningful work in their communities, and most importantly, they report a higher degree of satisfaction with their lives. We are in possession of hundreds of signatures from clubhouses across Michigan whom want the money to remain with CMHs and want all people suffering from severe and persistent mental illness to attend their local clubhouse. We urge you to support the efforts that we outlined here to support the CMH system, ability to serve all those whom are in need of treatment, support, and engagement. Please no 298. Sincerely, the membership and support staff of Crossroads Clubhouse, Warren, Michigan. And Bruce Denton is here as my support.
My name is LaQuinda Phelps. I come to you first of all as a parent. I come to you secondly as an educator, teaching special education for over 15 years. I've taught all areas of special education. Thirdly, I come to you as a consumer for myself and a consumer for my 17-year-old son. I purposely wanted to come to this meeting because my son is 17 years old. He started symptoms when he was late elementary. His symptoms are now manifested to where I had to literally deny him coming into my home in order to get services for him within the last 3 weeks. Here lies the problem. My son has a high IQ. He tested on college level in every area. He goes to Henry Ford II. Because of his IQ, his behaviors are not indicative of what they normally see in emotionally impaired students. So therefore, he does not qualify for special education services. Being a special education teacher, I knew that he qualified for a Section 504. But on a Section 504, because of funding cuts, you're only limited to so many services, which to him means nothing because the only thing he gets is a place to go when he feels himself upset. What about when he can't tell you when he's upset? What about when he gets to that point, which is where we're standing now? I've had services for him, therapists, CLS, and respite hours. We have been, for the last year, I quote, the last year, waiting on a CLS worker and a respite worker. We have yet to have a CLS worker and a respite worker in my home. Now you couple that on top of me being diagnosed in 2010 with MS and then 2 years later with Meniere's disease. He's been denied hospitalizations through access on many of times, more so recently within the last month again. My symptoms severed up so bad this time to I thought I was literally leaving this earth this time. My symptoms are only getting worse. They're not getting better. And I still don't have CLS or respite staff in my home for my son. I was just told that they're getting ready to release him from up under the Judson Center for outpatient therapy. He's been through the Juvenile Justice Center. I was charged $189 a day. I currently owe $98,000 for that bill. $98,000 is what they charged me for a child with mental illness because they had nowhere to place him. He has been in Havenwood Hospital. He's been in Harvard Oaks Hospital. He's been in BCA Hospital. He's been in Kingswood. You name it, he's been there. It's a vicious circle over and over and over again. Sterling Heights Police Department knows all 6 of my addresses that I've been in the last 6 years. Thank God we have a decent police department. I want to give hands up to them because they have been a blessing to my family and not harming my child. When we see so much of that going on, when we see so much of that going on in the news, because his behaviors are just that sporadic. You don't know how long it's going to last. You don't know when it's going to stop. It could go for an hour. It can go for a day. It can go for weeks. It can go for months. Yes, I apologize, but I really wanted to get here to say this. We don't need any more cuts. The school system can't help my child because he doesn't qualify for services. We're getting hours cut left and right through CMH. I still don't have any people in my home to help me. I am a single mother, have been. My oldest is 26 years. Take this back to your constituents and let them know about the Phelps household, about an 18-year-old who's getting ready to be thrown out in the streets. This is my daughter. Lastly, I want to say, this is my daughter, 24 years old, my caretaker as well as my son caretaker. It is not fair to her. She has fell into a major depression because she's had to take over of me as well as my son. My oldest daughter is not able to because she is severely LD. So it's only so much that she can do. When you talk about caregivers, this is a caregiver right here who's not being paid hardly nothing. I applied for Medicaid and got a spend down of $512. My home health care check, guess where it goes to? My spend down. They send a $98 check to my daughter. That's all she gets.
I know her time's up. I just, not only am I my mom's and my brother's caregiver, I also work as a caregiver. I have 2 clients. One of them is schizophrenia, the other one has Angelman syndrome. There's times that I work on weekends so parents can get a break and don't get paid because I understand. I have to leave work. My GPA in college dropped 2 whole point averages because I had to, stay up late at hospitals because we have no services. I had no one to call. All I have is my mom, my sister, and my brother. We have no family. And the first thing that comes out of everybody's mouth is, call someone. I have no one to call. I am the backbone. So if you guys take this away, who do I go to? Because his caseworker is who I call. He has no workers. Not everyone has a big family, so you guys got to keep that in mind too. Thanks.
Good evening. My name is Monique Stanton. I'm the president and CEO at Care of Southeastern Michigan. We're a nonprofit organization that focuses much of our work on substance use disorders. And I wanted to point out that substance use services are a critical part of our community mental health system. Not only do I have a professional passion for this work, but I have been personally impacted by substance use disorders. Many of you know my mother is in long-term recovery from a heroin addiction. She was absent for most of my childhood. Unfortunately, my biological father, Kenny, did not make it. He abused drugs and alcohol for his entire life. He likely had a co-occurring mental health condition. He was in and out of prison. Unfortunately, he did not access the much-needed critical services that are available today and died too young from his addiction. While I recognize that our system is not perfect, I do know that most Medicaid health plans would not have been proactive in reaching out to somebody like my biological father. He wouldn't have been able to access those services, very likely. While I recognize that we need to continue to make very much needed improvements, our current system is proactive in finding people like Kenny who don't necessarily fit the most ideal criteria and are difficult to treat. Our system also works with law enforcement, with education, with parenting groups, with the faith-based community. We've been proactive in adding recovery homes, peer recovery coaches, bringing much-needed naloxone to our first aid responders and our law enforcement to stop people from dying from heroin addictions. And right now, if we privatize this entire system, it is very possible that these critical services and collaborative efforts won't exist. I challenge you to recognize that our state budget is the single most important thing that shows us as citizens and you as legislators what our values are, who we prioritize, and what we prioritize. And so as you take into account these critical decisions, I ask that you keep in mind people like my father, people like the children here today, the parents that have spoken, the caregivers, and so the most vulnerable are consistently at the forefront of all decisions that we make. Thank you.